You're listening to Radio Cosmos.
All night long.
Bravo! My compliments, little lady.
Commercial!
Break for 30 seconds.
You are now listening to BaaD Radio.
Hello and welcome to BaaD Radio. BaaD stands for Business at a Distance. This is a show about local businesses and business networking. We are here in the News Radio WFLA Orlando studios from 11 a.m. to 1 p.m. every Sunday. And I am your host, Angela Smarito. And in studio with me, we have Melissa Jacob with Striking Brand.
Hello, hello.
Melissa is our co-host.
Yeah.
Okay, he got the clap.
It got there.
It got there.
It's a little delayed. It's okay. I'm usually late, so it's on. It's on.
He beat me here today.
Yeah. It's our late day.
But Melissa is our co-host as well as our videographer. And if you go to baadradio.com, that's BAAD radio.com, you can see all of the previous episodes of the show. And if you go to strikingbrand.com, then you get to see all of Melissa's other work because in addition to being a videographer, she is also a photographer. We have a new guest today. Please welcome Stephanie Kern with New Age Wellness to the studio with us. Welcome to the show.
Thank you.
Appreciate you. I know, we're going to have to find a better clip than that
Somewhere. It's in there somewhere. We're just warming up.
Yeah. So the claps get better.
Oh,
Okay, all right. It's
we'll
not from
see.
the Windows 1990 version of the...
Exactly. Oh, there you go.
That's
We're getting
see,
to the early
Stephanie's worthy of an
2000s.
applause like that.
Stuffing it up.
So tell us a little bit about New Age Wellness. I mean, I know that your name has chiropractic in it somewhere, but
Yeah.
wellness is the overall basis of the company, correct?
Wellness is the mission that we're trying to bring to the community.
Mhm.
Obviously, I'm a chiropractor, so we treat holistically through chiropractic and natural remedies, nutrition, rehab, medical massage, and things like that. So
Ooh, what's a medical massage?
that's a different type of massage that actively treats, because you can go to, massage therapists anywhere and say, hey, I just need one to relax me or something. And that'd be more like Swedish massage.
Sure.
And then if you got really bad muscle knots, they may do something like trigger point, therapy that focuses on a certain muscle group. So if you have like an injury, like a labral tear in your shoulder or a low back injury, like a disc herniation, that's where you want to go to somebody that's, does medical massage.
I feel like we're getting into Derek Brantley territory.
I know, for sure. Have you ever heard of Inbalance Body Works? He's one of our show sponsors.
Yeah.
So you know Derek Brantley?
I've seen the previous episode
Okay.
where you guys interviewed him.
Very cool. But yeah, he does some of that deep tissue stuff, but it's not massage. He's like, if the
Yes.
lotion comes
Do
out,
not say it's
lotion.
massage.
Yeah. If the lotion comes out, it's no longer in his territory, he said. I was like,
Okay.
all right.
It doesn't put the lotion.
No.
Okay. All right.
I love that.
On the skin.
Yes. We're going with us.
Yes.
Spooky vibe today.
Yeah.
What's going on?
Yeah,
like
his
it.
voice. And
Yeah.
Well, let's rewind a little bit. Let's hear a little bit about your background.
Oh, yeah. So I guess I should probably start, and this information's on my website too. I got into chiropractic because I was very much inspired by my uncle who's a chiropractor. So I'm second generation. He practices in North Carolina. But when I was, very young, he actually got into a really serious accident and he was stabbed, right? So he had to go to the ER and have life-saving surgery. But during that surgery that did, obviously save his life, they nicked a nerve going into his left arm. He got out of it, came home, couldn't play guitar, couldn't lift a gallon of milk. So he went to a chiropractor, friend of his, and got worked on for about a month or two, and got full regain of his arm
the
strength.
chiropractic helped with a nicked nerve?
Absolutely, yeah.
Wow.
So adjustments obviously remove interference on a nerve or
Right.
help regenerate, tissue in that way, and help your body function optimally through physiotherapies that we do at the office.
You're
And,
saying all these words. I want to know what they mean.
I'm sorry. I'll
Physiotherapy.
I was following.
yeah, she gets it. But yeah, so he got full use of his arm back, and was very inspired by that experience. And he changed his He was going to Northwest at the time, changed from pre-med to pre-chiropractic. Mm-hmm. Graduated Northwest, found a practice to buy in North Carolina, and he's been practicing chiropractic ever since.
Oh, nice. So did that happen when he was younger? And you were saying he was going through school?
He was an adult at that time, but I was the young one.
Okay.
So obviously, when I was getting into college and figuring out what I wanted to do, I went and go shadowed him and see how he was helping people.
Right.
And it really is like, yeah, this is what I want to do.
Okay, gotcha.
So at the time, Palmer College of Chiropractic in Port Orange opened up when I was just getting out of college, And I'm like, this is a no-brainer. I'm
Right.
just going to go right here. And, just went right there in my hometown.
What does chiropractor school look like? Is it like a 2-year degree? Is it, is it kind of like going to a doctorate school?
Yeah,
or-
so that's a good question. So in the state of Florida, you have to get a whole undergrad degree that, encompasses a lot of the prerequisites that you need, like biochem, physics, things like that, anatomy to get to, your 4-year degree, and then you go to graduate school. So it's 4 years, and then 3.5 years to 4 years in chiropractic school. So it's
That's
7.5
long.
to 8 years.
That's a long time.
And then you have to take 4 state boards after that to qualify for your license. So it's essentially the same as a medical degree.
Right.
The only difference is that they treat with pharmaceuticals and surgery, and we treat with nutrition and
I'm going
holistic
nutrition
measurements.
route. That's me.
Nutrition.
Oh, yeah.
Yeah,
I don't. I'm not into the whole Western medicine.
I know.
Like,
I'm trying
pop
to
a pill for
It's
everything.
so interesting because the past 6 years, the opioid crisis from the 90s to early 2020s now has times itself times 6.
really.
So yes, so it's increased death of overdose with opioid and pain medication 6 times since the 90s.
Aren't they making it harder for people to get their hands on the opioids? I mean, aren't they being more cognizant on like prescribing them?
They
or are they
might,
still
but
just be
the
writing it.
Overdoses are still rising, and so it's crazy that they're making it harder to prescribe, but it's the main source of remedy for a lot of people with low back pain. So the study just came out with National Institute of Health, and there's several studies that back up this study in March of this year that show that people that seek treatment for low back pain through a chiropractor first, have a 313% increase of employability and a decrease of disability, and also a 55% decrease of opioid use
Nice.
with treatment. So that's compared to seeing a PT first, seeing a MD first, their primary medical specialty degree like an orthopedic or a neurosurgeon. Their risk of getting a long-term opioid use skyrockets to 97% more chance
I believe it.
of treating. And that's crazy. That's crazy numbers.
Is that because you think like chiropractors are usually more like holistic?
We're just more effective.
Yeah.
We just
I like it. She's like, bam.
We're just more effective. We got the stamp on it. The American Medical Association says go see a chiropractor. It's better for our tax dollars because low back pain is the number one reason most people get disability in the United States.
Okay.
And so it's just better for insurances. They keep covering it. United Healthcare, Cigna, they're like, yeah, go because our costs are down when you go see a chiropractor, so we're going to cover it.
So a lot of people who might need to see a chiropractor but are nervous too. I think a common thing. I'm just going to use myself as an example. I have been, and I'm less afraid of them now. But before, what my big thing is like that neck.
The whole
cracking
popping.
thing. Like I just feel like it's so easy to just like do something a little off angle or hard, and then just you're like paralyzed. How realistic?
That's very traumatic paralysis.
That's what I think in my head. I'm not kidding. How realistic is this fear?
Yeah, so I totally understand. I hear it
I'm
all
with
the
you, though.
time.
I'm up, yeah.
Yeah, I hear it all the time, and it's you would have the same instances of getting paralyzed or getting some kind of a stroke when you go to a salon, you get your hair done, because the same mechanism that
I've
causes
heard of
that
that.
is putting your head back and rotating it. So what do they do when they,
Yeah.
So obviously there's ways to examine a patient to make sure that that's not a risk factor and order the appropriate test. So you need to go to somebody with experience. You need to go to somebody that knows what they're doing, just like any doctor. If you go to, and it's crazy that I hear that because nobody thinks like, oh my God, am I going to go and get paralyzed? But they'll sign up for a surgery tomorrow if it's going to fix up their low back pain.
That's true.
That's very true.
And compare an orthopedics malpractice to my malpractice.
Right.
What I pay a year, it's drastically different because what I do is way safer for somebody with neck and back pain than going to a neurosurgeon, going to your primary care, going to any specialty. They're like, yeah, I have no problem seeing a primary and getting prescribed this medication that may cause me to overdose, have all these symptoms,
Right.
That may have an allergic reaction to, but everybody's like, I'd rather do that still than go.
I know it doesn't make sense though, does it?
No, it doesn't.
Yeah.
It's because people want that one fix. Give me the pill to fix it, and all's good. I know it's crazy, but that music means already time for break. So we're going to go to break, and when we get back, we'll have more BaaD Radio, so stay tuned.
Welcome back to BaaD Radio, brought to you by Premier Couple Superstore, because a couple that plays together stays together.
Welcome back, and this portion of the show is brought to you by Premier Couple Superstore. Spring is in the air, so it's time for a trip to Premier Couple Superstore, and they have got a huge selection of lingerie, shoes, toys, games, love oils, and a ton of great gifts. With Premier Couple Superstore, you don't pay those high prices because you're going to go directly to the source. 5009 South OBT, or shop online at premiercouples.net, because a couple that plays together stays together.
Oh, yeah.
We are here with Stephanie Kern with New Age Wellness. We had a great first segment. It went so great. Look at Ken's in there chuckling. You can't laugh. You're gonna make me laugh. Yes, that is part of our show. The Oh Yeah, that was from Ferris Bueller's Day Off, right? Right? Bueller. So I know it goes by really fast, the 10 minutes, but I want to rewind just a little bit because we started to talk about your background a little bit, and so you did the chiropractic school, and then when did you start working for another practice, and so how did that all play out?
So I actually went up to the Panhandle and practiced for a little bit. I had a doctor there that wanted to partner with another doctor and kind of step away, and he wanted to do some real estate and other stuff. So I went up there and just realized like I missed home too much, came back home.
Is this home, Orlando?
Yes,
okay.
yes, yeah. So, well, I was born and raised in Port Orange, Daytona Beach area.
Yeah.
So I came back here, worked for, a few employers, one for like a year, one for like, a couple, and then one for 6. And so, and then after that, I opened up my own during the...
And what was that like? Was that so scary?
No, not really. I think it was a little bit more, just a little bit, because it was during the pandemic. It was October of 2020. So, I've been in the Castleberry area ever since.
So speaking of like previous employers, do you find that a lot of chiropractors get that reputation of just being, I'm not going to say ambulance chaser, but that's what they go after is the auto accidents, right?
No, yeah. I mean, that's how it is in Florida.
She said, I'm not going to say it, but
This is what I'm talking about.
you guys know what we're saying.
No, I've definitely seen some, business owners and, people that do that.
Why though? Is it because that's what they're all the money? Like it's more about the money than it is the actual.
For some, yeah. For some, I have a passion for treating traumas just because I've worked for some folks that are like that, and they treat for just people like numbers. They treat people like, they're just pumping them out one after the other, and it's like that's a person, that's like not everybody's treatment's different, and so I've found value that people can tell that my office and my care is quite different. We customize.
I can already tell
plan.
just by talking to you.
Oh, I appreciate that.
Yeah, I don't even feel even remote that like
100%
that the auto accidents. I'm sure that you probably have some auto accident people, but that's not the base of your
not
especially
at all.
because like you don't even have chiropractor in your name really. It's more of wellness, so that tells a whole different story.
Yeah, you got some like auto injury care or whatever, and they cater to that, which is fine. But we do everything. We treat health insurance, wellness patients. I treat kids, elderly. We have a state-of-the-art spinal decompression program.
Yeah, let's do that. Let's talk about all the different treatments and what that looks like.
Yeah, so given that we try to steer patients away from surgery and drug use and opioid use, we have a state-of-the-art spinal decompression program where I incorporate things like cold laser treatments, which is regenerative. It's light therapy. So it's kind of like sunlight on plants, except the light is on human tissue, and it just helps regrow things and injuries.
Is that the red light one?
It's similar but different.
It's supposed to be for like the red light. It's the one that for like wrinkles and things like that.
Is that the
nature.
UV something?
I don't know.
I'm getting them all mixed up. I need to go to that 33 microspot.
Yeah.
Get my stuff situated.
Yeah. But you know what I'm talking about. But I mean, is that the theory kind of, or no?
It's kind of, but it's really not. There's all kinds of light therapy. there's green light, ultraviolet light, there's red infrared light, and that's just on a different spectrum of the UV spectrum.
Okay.
So cold laser is different. It's
What would you use it on though? Like what
Yeah.
situation would you use a cold laser?
pretty much anything. I have a few patients treating right now for meniscal tears where they're trying to avoid surgery and they've tried everything else. So they're
Meniscal
trying.
tears, that's her knee?
Yeah.
Ha
I forget.
Learning.
People don't know, where's my,
Yeah, I know. And then I have a physical therapist dad, so I'm like, keep
Yeah,
going.
it's right next to your Nissan
Go
Maximum.
ahead. Yeah,
in your,
yeah.
in your
My dad just naming off all the muscles here, so I'm like, I was just asking for a stretch. I don't need to know the anatomy of the body.
Yeah, so let me say knee pain, shoulder pain, low back pain. It pretty much helps with any pain in any area except if you have something in your eye. You can't put the
Right,
light directly in your
sure.
eye, so we
Okay.
use glasses. But I've had patients that just got oral surgery done that really needed some pain relief and didn't want to take 800 milligrams of ibuprofen for 5 days, and they came in for a few sessions of the laser.
And it helped?
hmm
That's
I did it
really-
on myself. I had my
What does it look
crown put on, and that was, oof.
So what does it look like? I mean, like when I think of a laser, I just think of like a beam of light that like shoots
Yeah.
into something.
It looks just like that, except it doesn't create heat like a surgical laser would.
Right.
So it's it's just light. So it's not heat. You don't feel anything. It's just you sit there and it's a painless process.
And it takes away pain. It's just what?
so
yeah, right.
I'm gonna throw out some pretty crazy terms.
Just go
but-
ahead. Do it. Go for it. We'll Google it later.
Exactly.
yeah. So it uses, photomodulation therapy. So
Okay.
it's light therapy. So the light helps go down to the cellular level and helps regenerate the tissue. So it speeds up the healing process
Okay.
essentially. So just by putting the light on the skin.
So it's not a numbing process or
No,
anything.
no,
Okay.
yeah.
Okay. You're like that hurts, so we're
Okay.
gonna help it heal faster. That's how it's gonna get.
Yeah, and that's why I
healthy.
try to use the metaphor like, UV light on plants. You see a plant grow and, just regenerate itself just through UV light. And that's essentially what the light does for our
Nice.
tissue.
Oh, cool.
So.
I'm gonna use my
interesting.
own cough button there. But,
And then you were talking, sorry, it's still along the same lines, but you were talking about there's treatment that you can do for if you have allergies because there's so much pollen out now.
Oh, yeah. So
Yeah.
there's a lot of sinuses when they get inflamed. I don't know if you've ever seen a pollen underneath a microscope, but it's like a
No.
ball with spikes on it.
Okay.
So you breathe this stuff in, it gets, stuck in your mucus and stuff in your sinuses. You get stuffy, sneezy, and things get clogged up. So what happens during that is that your bones can shift in your face and in your ears
oh
and
my
your neck.
gosh.
And not drastically, but
Right.
enough to cause stiffness and discomfort and things to get clogged and things to get stuffy. So a lot of patients find a lot of relief when I adjust their neck, their sinuses, which are just, flat facial bones here, and also their ears. It just helps everything drain. And so, that is something that we can
When you're
do.
doing an adjustment, what exactly are you doing? I know that popping sound is like little gas bubbles. I do know that. But I
Okay.
mean, what exactly are you like adjusting a bone or a muscle or both?
Yeah, so all muscles are attached to joints, right? So when we're adjusting, it's directly on the joint that needs to move, that's stuck. It produces a release of pressure, and that gas, cavitation that you hear, that, just like,
Yeah.
yeah.
Thing
So-
that everybody tells me I'm not supposed to do.
Yeah, no, that's fine. You could do that all
Oh,
day.
I got a chiropractor's
Yep.
sign off
Oh,
on it.
growing up, they tell you your knuckles would swell.
Yes,
If you
that's
did
what
that,
I-
you're going to end up with like big old
And that you're going to have to constantly do it or something.
It's
You're going to
perfectly
get
fine.
arthritis.
arthritis. That's
That's
another
it.
one they used to tell
Yeah.
us.
Yeah, perfectly fine to do that.
I'm
Yeah.
doing it.
If
They
only
did a
they were
long-
still alive, so I could tell them today that I was right.
There you go.
Alive.
Yeah, 30-year
Well,
study they
it was your
did.
teachers and whatnot.
Yeah, they did x-rays before and after. 30 years, they showed no problem, no difference, no advancement in arthritis.
All right, there we go.
So you're good.
I think it's more of like a habit people get into. They pop it like
Like a
that.
nervous habit.
Mm-hmm.
Yeah.
So like you said, the joints well, let's talk about lower back pain. That's bone hitting bone or
As far as like what causes it?
yeah.
Yeah, there's different causes for it. I mean, that's what kind of gears in. I think we were talking about the spinal decompression, right? So that treats back pain, but that can be caused from cartilage damage in your back, from
What are some of the most common reasons you see back pain, lower back pain?
disc herniations, disc bulges, in the back.
What about sitting for a long time?
Something called degenerative disc disease, which compresses your spine. And basically what we do is open everything back up and stretch it with the decompression treatment. And that's from people that sit, truck drivers, people that work at call centers, accountants.
Is that an age thing too, though?
It can be if you never see a dentist for your whole life until you start having pain. I mean, that's what's your teeth are going to deteriorate. So same thing for your back. If you don't ever see a chiropractor until you start having pain, then there's some wear and tear that's been happening.
I'd like to talk a little bit more about that decompression machine, but we're going to go to break first. So you guys hang on. We'll have more BaaD Radio when we get back. Part of it doesn't surprise me, though, because like when I go to a primary care just for like my physical and stuff, and I'm like, what about, menopause? What about this and that? And they won't say anything other than like the textbook of what it's supposed to be. They won't say, a hormone replacement or anything that like, hormone wise to kind of help the situation. So that's a little bit sad, though. I'd like to see more doctors, send to referral to chiropractors and whatnot. So you have, we talked about the laser, we talked about the decompression. So what are some of the other services?
Yeah, so we do a lot of physiotherapies, like to complement what I do, so that treat soft tissue. Like if someone's got really bad neck pain, there's going to be a joint component and a muscle component.
Sure.
So through the chiropractic adjustments, we're going to address the muscle, the joint stiffness. And then we have, ultrasound therapy, mechanical traction therapy.
What's mechanical traction therapy?
Yeah, it's like you just lay on your back and there's some rollers that go up and down your spine and kind of stretch out your joints and your muscles. Nice. And just, a lot of my patients will just fall asleep right on it. It's great.
Oh, how big is your location? It sounds like you have a lot of different things to offer. So.
Yeah, it's about 1,800 square feet. And so it's a very large office. And so we're, just accepting new patients still and helping out anybody that,
Where in Castleberry is it located?
It's right on State Road 436, kind of in the junction of Red Bug Lake Road and 1792. So it's
Red Bug on. Okay, I'm putting. I always plan everything around like the Salvation Army on 436.
We're like right in front of the Castleberry tag office in the police station, if that makes sense.
All right. No, that totally does. Very well, like you said, that's actually really accessible. So that's a good thing.
Yeah.
And how long have you been open at that? You said it was during COVID, but
yeah, I've been there for 4 years adjusting patients, and we're open on Saturdays too, which people struggle with work and daily life to make it to their doctor's appointments, and at least if they can get in on a Saturday, that gives them some relief throughout the week.
And how do people find out about you? You do a lot of
social media. I have a business Instagram, Facebook page.
Nice. Do you find that hard to do since you're like doing your business and all the things and then also doing the marketing?
I mean, this is a struggle to do everything, but I try to keep up the best I can.
What are some of the things that you think are like the most successful that resonate with people?
As far as like social media,
bringing people.
I mean, everybody's on social media. Everybody you see is on their phone. I think the newest, ranked ways people search for quality doctors is Google first, and then Facebook, and then maybe like TikTok if that's the younger crowd and stuff.
Facebook business pages honestly is the second Google. That is absolutely true information there.
I know TikTok is just like the newer generation and everything's on TikTok, but I cannot imagine going to TikTok to look for a doctor.
My kids do it all the time. They're like, where'd you learn how to do that? She's like, I learned it on TikTok.
Well, that's one thing, like crafts and stuff. My daughter does the same thing, but I don't know if I'd be like, find me a doctor, TikTok.
You'd be surprised. There's plastic surgeons, orthopedic surgeons that have TikToks.
Well, it's 'cause
I believe that, but like I don't know. Like I need reviews. I need adults telling me.
Adults.
Yeah. But what about referrals? I would bet to say that referrals are a big part of your business.
Yeah, we're on Google website. In-house referrals, somebody tells a family member.
That's exactly what I'm talking about.
Yeah, for sure. I have a husband of a wife I just saw this past Monday coming in on Saturday. We get the whole family, so everybody needs a chiropractor. for sure.
Well, speaking of like that, how does it work? See, I know how it works with a doctor's office as far as like you have insurance, you go and pay, you go back for regular physicals. With a chiropractor, is that how, do you like buy sessions or do you buy?
So we like detail the patient's care plan based off of what's going on with them and their health and what they need, what their lifestyle is, if they work out a lot, if they travel a lot, if they do a lot of lifting, if they are sports oriented and they play soccer twice a week. So, or if they have an active injury, we're going to treat them a lot more frequently to heal them quickly. And then after that, we switch them and say, hey, based off of what's going on, your lifestyle, your health, I recommend to come in like once a month for maintenance, keep the stiffness or pain or injury that you have from coming back, or come in twice a week, because you play soccer twice a week or, 2 times a month or something like that. So it all depends.
So as far as like ages, like do you work with kids too?
Yeah.
So when you're talking about soccer and things like that,
And I think about kids as well.
Yeah. So my first thing is I think of is my youngest. She's 10. She's very she's into karate and gymnastics. So would that be like people who have kids that are into things like gymnastics, or I know your son's in baseball, would you recommend going to the chiropractor as like a regular thing or?
Yeah, so I had a 10-year-old come in last week that she was telling her mom, hey, I've got back pain. She started gymnastics. Some of the exercises were a little bit too strenuous on her joints, and they were creating back pain because she was doing hyperextensions and flips and all these things, and it was throwing her hips out, and it was throwing her back out. And, you don't want to give your kid a bunch of Advil every week if they're going to gymnastics or soccer all the time. So, and these kids are getting crazy recommendations that I didn't experience when I was in school. They have like 15-pound backpacks or 45-pound backpacks they carry, where I had lockers where they're carrying that for 7 hours a day.
Yeah, and in middle, they don't have lockers anymore.
We were just talking about that. We were talking about that. My oldest was complaining about back pain because of middle school, because they wouldn't let her carry a backpack around at all.
Yeah, their recommendations for playing a sport, getting them ready for potential college scholarships in high school. They're just training them like crazy and putting them through rigorous training that's sometimes even having them play through injuries just to like keep them active.
Right.
And so chiropractic is a great remedy for a lot of childhood problems like scoliosis, sprains, and we adjust them. They feel better. They actually respond a lot quicker than an adult.
So okay, this is no offense to anyone in particular.
About to insult somebody.
Oh, no, I'm not at all. I'm not at all. This is coming from a place of, we'll say, ignorance. Because this all makes sense, and I would love for Caitlin, as my youngest, her to do the best at gymnastics and be able to she's not complaining about being in pain, but it just seems like something you're moving your body a lot. At the same time, I would be so scared bringing her to, in my head, I'm like, her body's still growing, chiropractor's moving and shifting stuff around. That seems scary to me. Do you want to talk about that after the break?
Yeah, we can.
Yeah, so we're going to address the scary part, but I understand what you're saying.
Yeah.
I do. I worry about that with Aiden's arm as well. So, all right, we're going to go to break, and when we get back, we're going to talk a little bit more about that. So stay tuned for more BaaD Radio.
Welcome back to BaaD Radio, brought to you by Premier Couple Superstore, because a couple that plays together stays together.
Welcome back, and this portion of the show is brought to you by Ground Up Property Services. Do you know what your sprinkler system did last night? Probably not. So now's a good time to get your irrigation system serviced by Ground Up Property Services today. And be sure to ask Rick Hall with Ground Up about a water sensor too, so your lawn doesn't get too much water. And don't forget about the lawn painting service. If you are planning an outdoor event and you want to hide those brown spots on the lawn, call 407-468-4295 or visit groundupinc.net. We're here with Stephanie Kern with New Age Wellness. And before the break, Melissa posed not so much a question, but sort of a feeling about if we have children that are in sports and they're not really complaining, would you still recommend that we bring them? And I'm in the same situation with my son. He plays really competitive baseball. He's a right-hand pitcher. He doesn't complain, but I know he's 17 years old and he's still growing, as is your daughter. And so it's okay, if they're not complaining, but yet I bring them for maintenance, and then something hurts afterwards.
Yeah, really, that's the thing. If you want to speak to like how their body's still growing, and if that's like how should we be nervous of that sort of thing.
Yeah, that's a valid concern, and it's a valid question. So every chiropractor gets standard education on how to treat adults and children. And so the treatment that I would give an adult that's full grown, wouldn't be the same treatment chiropractic adjustment technique wise that I would give to a kid.
Are they vastly different though?
They can be. So
Okay.
the amount of pressure I would, give on a children's adjustment would be maybe the same pressure I would checking a cantaloupe in the grocery store or something, or your own eyeball. It'd be very gentle. The goal is to guide the joints back into alignment, and sometimes it doesn't require a whole lot of force.
Can you feel it though when you're doing the adjustment? Can you feel when it's gotten to the point where it's supposed to be?
I've adjusted as young as a 2-week-old, and so babies, they have issues too that can be treated chiropractically. I'm part of the International Chiropractic Pediatrics Association.
Nice.
So I've treated kids for ear infections, colic, and I've screened them for scoliosis. And before it becomes a problem, we could say, hey, visually there's a test that you can see to show, hey, yeah, this person has scoliosis. That's something we treat, and we could start getting ahead of it before it gets worse and their bones fully fuse.
Can you do stuff to prevent scoliosis from getting worse?
Wow.
Yeah, absolutely. Yeah, unless there's something that's congenitally wrong with them.
Right, right.
There's nothing I can do about that. Or if they have a neuromuscular disorder, we can't cure cerebral palsy. We can't cure muscular dystrophy, but we can make them comfortable through chiropractic adjustments to ease their pains naturally.
That's really cool.
So,
So during the break, I asked you if you didn't mind if we talked a little bit more about like surgery versus like the decompression machine, because am I right in saying the decompression machine helps a lot of people avoid surgery?
oh yeah, for
so
sure.
when somebody has back pain and they have to get surgery, what are they doing with that? I mean, what is the surgery actually doing?
Well, there's different types of spinal surgery. There's things called laminectomies, where they take out a piece of the bone to allow the nerve, to get unpinched. They do discectomies, where they go in and actually replace a disc in your back with something more man-made. There's something called a fusion surgery, where they actually take rods and screws and fuse two bones together and keep them from moving.
That sounds awful.
Yeah.
To screw two. I mean, don't you want them to move a little bit?
So, I mean, it depends on what's going on. I mean,
Yeah.
there's a lot of issues that people can have that they think surgery is the answer. And so our spinal decompression helps them avoid more invasive procedures that, they can potentially avoid if they have sciatica, if they have a disc herniation, if they've got generalized back pain. And we treat neck and back issues and not just back with the spinal decompression.
Well, decompression to me, like I said, I think of like pressure and the air volume, but is it like a stretching machine?
Do you hang upside down?
Yeah.
No.
For some reason,
I do too. Tom used it.
Yeah.
It helped. My husband's Tom. He used a decompression machine to help him avoid surgery, but I never asked him if he hung by his feet.
From a doctor's perspective, I don't really recommend those inversion teeter tables too much. There's just too much pressure that goes from the blood into your head, into your eyes, and it doesn't really treat anything in your neck if that's what's going on, or your mid-back, or and it comes with its own risks associated with that because of gravity.
What is the premise of the decompression? How does it work?
So yeah, we just lay
it
you
table?
on the table.
Okay.
You lay, if you're in your neck, there's working on your neck. There's a neck cradle. We strap your head in and set the machine to a current poundage of pressure.
Crank the chains.
No,
It's not that.
no. There are some that are like that.
Yeah.
That have like pulley systems, and they
Yeah.
look a little medieval.
Yeah,
and
that's what
they're
I was
like,
thinking.
yeah. Ours is state of the art. Ours is like mathematical sensors.
Okay.
So it's just a table that you preset through a tablet, and it just does it for you, and very gentle. People fall asleep on it most of the time.
And it just kind of
So-
goes up and down depending on where in your back.
Yeah, the table itself has different areas where it'll actually move apart. And so, like if you're working on your back, we have two straps that go underneath your ribs, one around your waist, and then the table pulls itself apart, and then compresses, decompresses on different intervals, and just kind of stretches your back out.
And what does that look like cost-wise?
Yeah, so a lot of people vary depending on the type of technology they use. Ours is very middle of the road. Ours is very affordable. There's 2 options that we give patients because we understand cost is a factor for people.
Oh, yeah. And you said you do take insurance, but is that one of the things that insurance is kind of like?
Unfortunately, it's FDA approved, but it's not something insurance have decided to cover. Unfortunately, and that's the same with like stem cell treatments or regenerative medicine or anything really holistic that's more so effective than just standard routine chiropractic and stuff. So, but ours is very middle of the road. And we do 20 visits.
So that's you buy it in visits.
Well, we have a program,
Okay.
so we recommend a minimal therapeutic dose of 20 visits on the machine.
And how long is each visit?
About 20 minutes.
Okay, so that's not terrible. And you do it like once a week or every other day?
If someone has active pain, it would be the same as like any treatment plan, whether you're going to a physical therapist or a chiropractor. It would be pretty aggressive to the start. It would be 3 times a week, and then we tamper patients off.
Yeah, that's, like you said, that machine was a heaven God sent for Tom and I, because he tried everything.
Yeah.
I was really pregnant with our second child, and he couldn't lift more than like 30 pounds. And it caused, what is that word, when atrophy or whatever, and when like where he lost
Muscle
muscle.
weakening.
Yeah. And it was terrible, but the decompression machine helped him, and he never ended up having to get surgery. But is that something that and that was quite a few years ago, Aiden's 17 now, but and he never had an injury though. It just all of a sudden he ended up with like 4 deviated whatever in his neck. You know what I mean? It just sort of happened.
Just one day.
Yeah. Is that really weird?
That's the nature of our body. It's really terrible that, you don't feel a cavity unless it's been there for a while, right? And then all of a sudden you wake up, my mouth hurts.
Right.
And, you don't have a heart attack unless you have heart disease for a long time. And some people have it undiagnosed, and then you just wake up and have a heart attack. Something triggers you. So unfortunately, he probably had disc herniations for a long time and just didn't know, never got it treated preventatively with wellness visits by the chiropractor. And then one day it just flared up.
Yeah, it was pretty terrible. But so is that the main, as far as the practice goes, so the wellness is all the other pieces that are in addition to chiropractic, right? So we're coming towards the end of the show right now. So we'll just go ahead and list off all of those different things now. And then I'm going to give you, we're not done yet, but just like I said, think about that. And then all of your contact information as well. So let's talk about the different services.
Yeah, so we do spinal decompression therapy, cold laser therapy. I perform also Department of Transportation exams for DOT workers.
Okay.
We do auto accident treatment. We obviously do physiotherapies and chiropractic, and medical massage, and nutrition. So,
and this is along the same lines of that question. So when you go in for a regular appointment, what does that look like? Because when I went in, what it was kind of like a 3-part deal. Oh, crap. I guess I'll just skip. I was just going to say they usually do like a kind of a workout type thing, and then a massage type thing, and then the adjustment. So it's like multiple things kind of at the same
we
time.
do an exam. We make sure it's medically safe to treat you. We'll do an adjustment or whatever treatment you need that day, and then go from there as far as recommending a treatment plan. So.
All right. We got about 30 seconds, so go ahead and give all of your contact info.
Yeah, so New Age Wellness, newagewellnesschiro.com. We're in Castleberry, Florida. You can find us on 853 State Road 436, Suite 1029, and
Awesome.
All right, and you can find me at strikingbrand.com.
And I'm Angela, and we'll be back with another hour of BaaD Radio.